Greetings to all viewers. I am Dr. Shobna Mohandas. Today, I would like to discuss a video on the common myths that surround contraception in among normal people. I won't be covering the whole topic. I work in Thrissur, mainly in Sun Medical Center now. Uh, it's a joy to have a baby for everybody. But before your career has reached the required heights, financial constraints are not properly solved. And in the middle of that, if you get a baby, young couples generally don't like it. And they would like to secure their future before they embark on a family. And for that, you have to remember that hard work is the key to success, and you cannot take easy ways out because that will not give you the desired results. So it's easy to say, I will avoid the days when the sperm meets the ovum and gets into the uterus, and so safe period is the best because ovulation occurs some 2 days here or there after the 14th day. So we will just avoid that period. But the point is that the sperms also stay alive for almost 7 days, 5 days. So you may have to avoid intercourse from day 7 to 21, which is too long. And most women do have irregular periods, and then so this calculation goes awry. Lastly, the chance of pregnancy is as high as 25 to 35 per 100 women. You would generally not go through a road which has got too many potholes because that will spoil your car. Similarly, if a method is so prone to failure as much as 24 per 100, it's better to avoid that method. Another thing is the pull out method where the penis is pulled out of the vagina before the man ejaculates. But even if the ejaculate is little near the orifice, the sperms can swim up into the vagina. So the man needs to ejaculate far away from the female, and that may not always happen. And if a drop falls somewhere near on the legs or the labia, they can still travel into the vagina. Although the effectiveness of this method is considered to be 78 to 96%, generally couples who have been practicing it for long and have good effect with that, they end up like, in this Bro Daddy film where the couple gets a child late in their life because all their life, a lot of people use this method and they end up like the couple in the movie with a pregnancy late in their life where they don't even realize they are pregnant because they think irregular periods are the norm in the late years. So these things can happen, and definitely safe period or withdrawal method is not a very good method of contraception. Now, all over India, everybody uses the emergency contraceptive pill, which is commonly sold in the brand name of I pill, which is taken at about 24 to 72 hours before the after the act. Before 72 hours, if you take, you can avoid a pregnancy because it delays ovulation. But the point is, emergency is emergency. You normally walk, you don't go on a stretcher unless it's an emergency. You normally go through a door, you don't climb a wall. So, similarly, emergency contraception can delay ovulation, disrupt the sperm egg fertilization, hinder implantation. Everything is right, provided it is only done as an emergency. It cannot be used as a regular contraceptive method. For that, even the same name, you have another one, I pill daily. That's a 21-day tablet which you have to take every day. That is the correct method to use, not a emergency contraceptive pill used when, as and when you please, because it can lead to irregular periods, which can become so irregular that the doctor will have to treat you. And you may get unwanted pregnancies. Again, you'll have to go to a gynecologist. So instead of all that, why don't you go straight away and find out which is the right method for contraception instead of using emergency pills as and when you please? So, I pill is not the right method as a regular contraceptive. if it's a failure of contraception, one day you forget your pill or something like that, there I-pill can help, not as a regular contraceptive. The effectiveness is 95% if taken within 12 hours, 85% within 48 hours, and only 58% when it is taken within 72 hours. Still, there is a margin where the effectiveness is not there. Therefore, you should use methods which have more effectiveness, which is the regular oral contraceptive pill, which can come as a pill, patch, ring, shot, implant, a lot of ways of using it. The commonest method in India is the pill. It is taken daily at the same time, started from the second day of the periods, and it has to be started on the same time, even if the partner is not present in the beginning. You cannot start the pill once the partner comes. If you miss one day, you have to take two next day. You miss 2 days, then there's no point in taking it. And this is used all over the world. So only people in India are scared that hormones are bad for you. Hormones are this and hormones are that. All over the world, from 12 years onwards, they are using this pill. So it should be good. Otherwise, why would everybody be taking it? Maybe there's a little bit of nausea, breakthrough bleeding, decreased periods, which is actually less bothersome. Maybe a little bit tender breast, maybe there, discharge, maybe there. The older generation had weight gain, but newer generation pills don't have even that. And it's good for avoiding cancers like endometrial, ovarian, or colorectal cancer, decreases pelvic inflammatory disease, and even preserves the bone density. So your bones are less likely to break if you have been using OC pills. It can decrease the pain during periods. It can reduce heavy periods. It can reduce anemia. It can reduce premenstrual syndrome like fatigue, irritability, mood swings, all that can go off. Acne, reduce hair growth, all can be reduced with this. So when there are so many good qualities of the OC pills, why don't you take the regular OC pills instead of using emergency pills? Another thing is, as soon after pregnancy, people feel that if the menses have not returned, then you are safe. It's not like that. You can have a sporadic ovulation even without periods, and then that will go into a pregnancy and it will not be understood by the patient. So even without periods, it is better to use a contraceptive method. And after pregnancy, commonly used method is copper IUD. It releases copper into the uterus. Most people in India feel it causes a lot of bleeding and it is difficult. It may cause complications. But if it is so full of complications, why is it still there in the market? That it has stood the test of time. That itself is enough for you to understand that the copper IUD is a very good method. Just when you go on the road, you can have accidents, but that doesn't make you stop from going on the road. Similarly, using a copper IUD is definitely safe, even though a few small little percentage of women may have problems. But you have to use some method instead of going in for an abortion, because abortion can have its own complications. Only thing is, you do not know about them. Contraception is definitely better than abortion and should be resorted to instead of using unsafe methods of contraception. Thank you so much.